If you are planning your pregnancy, you are going to want to watch this episode because I'm going to share with you many tips. I'm not sure exactly how many because I have a lot of information I'm going to give you today and I didn't count them. So be sure to stay tuned for the whole thing because I'm going to share some really important information for you. I am Denise Noyer-Erez, and I am the CEO and Clinical Director of AIM Women's Wellness Center in Westlake Village, California. And what I do all day long is help you prepare your body for pregnancy. So we're going to share about that today. So please be sure to give me a thumbs up when you find this information very helpful, and be sure to subscribe to my channel. Okay, so first I wanted to talk about one of the biggest mistakes most women don't realize. One of the biggest mistakes that they do is they don't realize that it takes at least 3 months, and we're now really talking about, and we're meaning the scientific community, the science, like really understanding the body, 3 months, at least 3 months to prepare your body for pregnancy. And so it's so important to plan. And I know you've been planning. And so I'm going to make sure that you have done some of the things that you needed to do or that you need to do in order to make sure that you are as healthy as possible so that you can get pregnant, stay pregnant, and have a healthy baby. Because we know that if you are healthy, then your chances of having a healthy pregnancy are so much more there, and you will have a healthier child. We know that. So it takes both partners, although I am going to be focusing on the women today. And if you want some more information, you can check out one of my other videos. And on the male factor, I have a ton of those videos as well. Maybe we can post them, make them available for you. So first of all, the reason it's so important to do a 3 months of minimum of preconception care is because you are born with all your eggs. And so what happens is 3 months before you ovulate is when you start producing that egg. So your body is preparing all the time for that next menstrual cycle, because every month that you're not pregnant, your body, it wants to try again and try again. So it's made millions and millions of eggs because it is naturally challenging to get pregnant, and it wants to give you the best possible chances. And what your job is to make sure that it is in the best environment, because it makes a huge impact. And there's a window of opportunity 3 months before, at least a minimum of 3 months, that can really impact the health of your baby and the health of your pregnancy. So there's some things that are really important you want to make sure that are done while you're focusing on egg quality. And it's really focusing on the importance of your health. Okay, so that's what I like to do, is really focus on your health, because I know if you're healthy, not only are you going to increase your chances of getting pregnant, staying pregnant, but you're going to increase your chances of having a healthy baby. So important, right? So I wanted to talk to you. Hopefully you're aware, although I do see lots of women who are not aware of smoking and the challenges that smoking causes for your pregnancy. But not just before you're trying to conceive. During your pregnancy, you probably are aware of, but after pregnancy as well. So smoking is a really big no-no, and that goes for men too. Smoking really impacts the sperm quality. It can really affect that. So smoking for at least, no smoking for at least 6 months. I was going to say make sure that you quit smoking 3 months, but really I think that should even be longer, like 6 months before you try to conceive. And I know smoking, cigarettes is one of the most challenging things to quit. So I find that hypnotherapy helps really well if you're challenged with smoking. Hopefully just knowing that you want this child so badly and you want it to be so healthy will help as well. And then acupuncture actually does help. It helps detoxify the body, helps you relax. And they say and I think the reason why hypnotherapy is so helpful and also acupuncture, but meditation, it's because of the breath. The thing about smoking is when you take that deep breath in, it helps you relax. So a lot of times meditation and breathing can be really helpful in that as well. And that's usually why a lot of people like to smoke, is the relaxation. There's some other reasons as well, but anyway, smoking, definitely you want to quit. Alcohol, that's talked about a lot. It's so important to stop alcohol before you're trying to conceive, at least before, in between your period and ovulation. And you don't want to drink too much because alcohol is toxic, and it can really have a negative impact on the quality of your eggs. So, but a lot of people don't realize that after ovulation, you're going to have the fertilization. That baby is growing inside your body. And so even though you're waiting that 2 weeks that your period, doesn't start, or if you're waiting for it to start, then you don't want to be pregnant during that 2 weeks, because development, as soon as that sperm fertilizes that egg, the development of the embryo is like crazy fast. It's constantly reproducing. So you don't want to have anything that can possibly be a barrier or have some type of be a problem in that, right? You want to make sure that everybody's as healthy as possible. So that's something that I know a lot of people don't think about, is until they are pregnant, they want to stop drinking. So it's important to stop before, and at least minimize it if you're trying to conceive, and definitely stop if you're trying to conceive after you've ovulated. Don't drink after you've ovulated if you're trying to conceive. I see that happen all the time. Drugs and marijuana is a big problem. If you're trying to conceive, you don't want to be doing drugs or marijuana so that you can have a healthy baby. So there's still a lot of research out there. We're trying to figure out about marijuana, but marijuana has over 500 chemicals in it that we don't know about besides the THC. And we know that it crosses the placenta barrier, and it can affect the baby's brain. And we know also that it crosses into when you're producing milk. So marijuana, or even the CBD oil, we don't know enough about. You want to be really careful with, or not do, when you're pregnant. I feel, in my opinion, that you shouldn't be doing any type of drugs or smoking between trying to conceive, during pregnancy, and then during that crucial time, and while you're breastfeeding. And of course, you're never in front of around the kids. You don't want them to be exposed to that. So those are some really important tips. Just a little tweak you might have known about, but just a really minor tweak. I see a lot in my clinic, and when I'm working with people across the country, they don't really make that deep connection. Another one that I see a lot is, so we're going to talk about, diet. You know that I'm really big on diet because you have so much power with the foods that you eat. But one thing you really want to watch out for is the fish, right? So I always ask, how many times a week do you have fish? And you really just want to make sure that you are getting good quality fish and low mercury fish, because what happens, so for example, tuna is known as a high mercury fish, and it's probably one of the most eaten, tuna and salmon. Salmon is safe, but a tuna it has a lot of mercury in it, and it stays in your body for a long time, and it can affect the baby as well. So it can affect your fertility, your pregnancy, and your child. So you really want to have low mercury fish, and there's different grades of fish. So you can, look that up on the CDC. You can ask your fish market, the person behind the counter if you're getting some fresh fish, which ones are lower mercury. Usually, trout, it tends to be salmon. We know those tend to be more lower mercury fish. So those are some good ones for you to keep with. I think orange roughy is a good one. Anyways, there's a whole list of the different grades for the types of fish you want to have. Now, fish is super important, the fish oil. And one thing that I don't like to see is a lot of the prenatal vitamins have only part of the fish oil in their vitamin, which is the DHA part. You want to make sure that you're getting the whole fish, the whole molecule of fish, the EPA and the DHA, because they are essential fatty acids and your body needs them. And the only way you can get them is if you eat it, or supplement it. So fish is really important to make sure that you're getting the whole, both the EPA and the DHA. So, so important. So that's going to be, so if you're eating fish, just make sure you have low mercury fish. Make sure if you are supplementing, which I usually recommend, that you supplement fish oil, that you have a good brand and that they do test for mercury, because it will be really important. So you want to make sure that you are getting a high quality brand. Don't go the least expensive on those supplements. It's really important that you get good quality supplements so that you know that you're paying for what you think you're putting in your body. There's nothing worse than thinking that you're doing something good and really you haven't done anything, or maybe you even harmed yourself. So it's really important to make that investment. Okay, so those are some really, I find really important tips. Some, as far as prenatals go, I don't know why, maybe you can comment below if you're one of these people to share with me. I've been seeing so many women being on a multivitamin and a prenatal vitamin. You don't need to be on both, just be on a prenatal vitamin. You definitely don't need to be on both. I'd love to know what is going on, you know, what's in your research that you're feeling that you need to be on both. Please don't be on both. That's going to cause a lot of problems because you're having too many vitamins and fat soluble vitamins that you don't just excrete out by drinking a lot of water. You need to, so it's really important to high quality prenatal. Make sure, you know, you have all your testing done. Make sure that you look at your blood work. You're making sure your blood sugar levels are in a healthy range, that your cholesterol is in a healthy range and not too low, because cholesterol makes hormones. So you need to have enough cholesterol. It's really important. Making sure your weight is in a good place. You know, if you're underweight, you can have a hard time getting pregnant, and then if you're underweight when you're pregnant, you can have a hard time nourishing the baby. So it's really important to make sure. Sometimes you just need to gain 3 or 5 pounds, and I know that's tough when you're tiny and you can't gain weight, or you're tiny and you're so conscious about how you're looking. But it makes a big difference on your fertility and on the health of the pregnancy, which will contribute to the health of your baby. And the other thing is you're overweight. You know, again, just losing a few pounds can make a big difference, because when you're overweight, you have higher risks of complications like high blood pressure, gestational diabetes, preeclampsia, early term delivery. So those things, and a ton of other things. So, and then it causes your recovery to be more challenging, puts you at risk, and can put your baby at risk. So it's really important to just be on top of that. And if you are overweight, just be really mindful of your health and keep choosing healthy options, especially during your pregnancy, so that you can nurture your baby. So it's not impossible. It's really important to try to, again, prepare your body before you get pregnant. And if you can lose a few pounds, 5 to 10 pounds, depending on where your body mass index is, then that would be optimal. And again, we're talking about the optimal and planning for your pregnancy. So important. So even if you've been trying for a long time, these are some tips that are really helpful and beneficial for you. So some other things, I just want to remind you again that healthy parents make healthy babies. So we want to be as healthy as possible. Some things you want to be aware of are your genetics. You know, you also want to be aware of your environment, and you want to be aware of how you're feeling, of your behavior, your emotional behavior. And if you've been trying to conceive, there's a good chance that you're feeling really frustrated and sad. And so I would want to help you reframe that, and, you know, focusing on the things that you're grateful for, and really know that if you are having some challenges emotionally because you thought you were going to be pregnant a year ago and here you are, you're still not pregnant, that it's so possible for you to get pregnant as long as you don't have, as long as you're still balanced, your body's balanced, and there's no, I'm trying to think of the word, physical blockages that you can't get pregnant naturally. But there's also IVFs. If you do, someone just wrote me, can you get pregnant with IVF if you have blocked tubes? That's the perfect time to do IVF. In fact, that's probably one of the best times to do IVF if you can, because you can absolutely just bypass that whole process and get, but you still need to prepare. You need to prepare for IVF. In fact, I'm having a webinar this Thursday. If you would like to find out more information, I'm going to be diving deep into how to prepare for a successful IVF to increase your chances during that time. So it's pretty much, it's very similar. You still need to prepare just as if you were going to get pregnant, because really that's what you're doing. You're going through a medicated cycle, but you're really preparing your body for pregnancy. So even if you're going for IVF, you still need to prepare. And I don't know why, but it feels like a lot of the women that I see don't find that that's important. They're not educated on that topic about preconception care for pregnancy. So important, okay? And the emotional part, again, you want to make sure that your mind, body, and heart are in alignment. And when your mind, body, and heart are in alignment and everything is balanced, that's when you will conceive. And there's different steps that you have to do for each piece, right? It's like you can't say those affirmations over and over again. There are no weeds, there are no weeds, there are no weeds, and then never go outside in your garden and pull the weeds. The weeds are going to grow. If you don't pull the weeds, they're going to grow. It's going to be a mess. So there's different, you have to make sure that you're in alignment. So the affirmations and thinking positive is only part of the whole process of getting pregnant. And then taking the steps to make the changes of eating properly is another piece of that. And then your thinking is another piece of that. And you can manage your thoughts. So I want to just encourage you to be the manager of your own thoughts, okay? So I still have a ton of more tips, but I think that I gave you a lot of information today. So if you have anything that you would like to share with me, any of your ahas, I'd love to see them and hear about them. If you have any questions, please feel free to comment. Make sure to share this video and subscribe. And if there's anything I can do to help you, I am available for you. You can just type in the word connect in the comment section below and we will reach out to you, or the Fertility Godmother bot will reach out to you depending on where you're watching this video. And what else did I want to tell you? I think that is it for today. So we will see you next week. Thank you so much for watching and joining me. And I will see you next time. Here's to your health, happiness, and fertility. Bye-bye.